This is your Houston chiropractor, Dr. Gregory Johnson. We have Eddie back here with us this afternoon, and Eddie has come in today after going to get his diagnostic studies done, which I ordered after my initial consultation, history, and examination with him. I found that he had some positive orthopedic neurological tests that led me to believe that he had a herniated disc or spinal canal stenosis in his cervical spine, which he's getting radicular pain out into his left shoulder and left arm. So that's called cervical thoracic radiculopathy. And sure enough, the MRI report comes back and he does have left paracentral disc herniations without spinal canal stenosis. That's good. But he's got spondylosis and spondylolytic changes, which means degenerative joint disease, degenerative disc disease, osteoarthritis. Those are all interchangeable words. I know you guys have been Googling up a storm on that. So I'm going to show you, we're going to treat him with the decompression first because this is absolutely what he needs. Gravity's constantly pulling him down. Now, you played football in high school and college, right?
Yes, sir.
So he's had a lot of compressive stress to his cervical spine. He's probably got degenerative disc disease and degenerative joint disease all the way down his spine, but he's having most of his symptoms and issues up in the cervical thoracic region, correct?
Right.
Okay, so we're going to focus on that. I'm going to have you close your eyes for me now.
Okay.
And bend your head forward and backwards there, Eddie. Now see, it's hard for him to go backwards because when he does that, it pinches on the nerve more right there, doesn't it?
Yes, sir.
Okay, so I'm going to put him on the decompression table because I've already looked at his diagnostics and know exactly what he needs. Go ahead and lay back. And I'm going to have you scoot down this way just a tad. There you go. Now these pins are going to feel kind of tight on top of your pelvic bones. Slide down underneath that a little bit more. There you go. And this one's going to be tight here too. Did you feel compressed in your spine too when you came in? Did you feel overall sense of compression in your spine? And that's what a lot of y'all will feel, is that you'll just feel like somebody's sitting on your head or on your shoulders all the time, compressing your spine down. And that's exactly what this is for. It decompresses the spine on the y-axis. So I put this towel around his occiput and his mandible. Okay, put your hands right here and relax. Breathe through your nose. Keep your teeth together. There you go. Boy, I felt that move good. Did you feel all those move in your neck?
Yes, sir.
There we go. I had you in there good and tight. You weren't going to get away, were you? Okay. Now I'm going to do the Palmer diversified rotary brake. Drop it in my hand. Tilt left a little. There you go. Now I'm on C6 lamina. There it is, right there. Yes, sir. Anybody ever done that to you before?
No, sir.
That's your first adjustment ever?
Well, you did, I think, the last time I was here.
Okay, so let's come over here on your tummy now. There we go. Put your face right down in there. Okay, see his right leg is short by over ½ an inch. I'm looking right where his sole and his heels meet, not the bottom of his shoes. And then when I bring him up, you can see the legs get even. That tightens up in your low back too, doesn't it?
Yes, sir.
Okay, you're gonna feel your low back raise up a little bit. I'm gonna adjust your left SI first, then your right SI. Now your sacrum, which is the middle triangular shaped bone right in the middle of your pelvis. There's L5. There's L4, there's L3, L2. Oh yeah, boy, that moved good today. Yes, sir. crack addicts are gonna love you, Eddie. There you go. Keep breathing. That's it. You don't want to hold your breath on any of that. There you go. Got you. You feel that?
Yes.
Alright, so now we look back at his legs, see they're exactly even. And when I bring them up, they stay even. That should feel less tight than the first one, Eddie, does it?
Yes, sir.
Okay, good deal. Alright, so I'm going to adjust that cervical spine from the rear now. This is adjust, just like that this way a little bit, please, sir. I'm adjusting right in the lines of the facet joints, P to A here with this. And then T1 to bring his whole head and neck back up over his cervical spine and try to restore his cervical lordosis. Let's turn you on your back now. So the official diagnosis for his condition is cervical thoracic radiculopathy due to cervical intervertebral disc herniation. There we go, good. Now let's put your arms straight out to the sides, palms facing up. There we go. There we go, good. Okay, now just relax your hands on your tummy. Let me have your leg. There you go. Should have felt that from your knee all the way up into your lower back. Did you?
Yeah.
Feel a little taller now?
Yeah.
There we go. Super. Okay, let's sit you up, face that way, please, sir, sideways. There you go. Now, you see you want to try to keep your chin up. I noticed you drop your chin down a lot. That's probably just habit, huh?
Yes.
And sleeping on that big pillow. What are you going to do with that big pillow tonight?
Remove it.
That's right. Good man. There we go. Everybody always asks me what kind of pillow to use. I recommend the softest down feather pillow that you can get. Those Tempur-Pedic pillows are for crap. They push your head forward and they straighten out your cervical spine even more. Plus they're uncomfortable anyway. A down feather pillow lets your head sink all the way back into it.
Okay.
And that way it'll help restore the curve in your neck, and the pillow actually comes up and fulfills that too. Let's stand up right here in front of the mirror. Okay, let's have you flex your head forward and backwards again. Now this should feel a little easier going backwards this
Yeah,
time.
it's not as bad.
Not pinching as
yeah,
bad?
Yeah.
Not going down your arm as bad?
Yes, sir.
Super. Let's take a look here and get this up and back. Now I'm not putting him in a great deal of extension at this point because he's got still these herniations down in his C5, C6, C6, C7 disc levels. Okay, now try that again. I bet you this feels smoother than the first one did even. Yep.
Oh, yeah. Oh, yeah.
That's easier, wasn't it? So, Eddie, how would you describe your very first experience on the decompression, and how's your neck feel right now versus when you walked in the door
It
today?
feels 100% better.
Does it?
Yeah.
You having pain down your left arm right now?
Well, it's a little tingling, but it wasn't like it was before I came in.
Okay, good. So, would you recommend to other people that have herniated discs that this is a good thing to do?
Oh, yeah.
Okay,
Oh,
thank
yeah.
you.
Yeah, I would.
Appreciate you sharing your information with everybody.
All right.
This is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief, Chiro Trust member since 2012. We'll see y'all next time.